The Hispanic community is being impacted by the coronavirus pandemic at disproportional rates compared to their white counterparts. These numbers are from the Centers for Disease Control in the U.S. Cases in the Hispanic or Latino communities are almost 3 times higher than cases in white populations. And then hospitalizations are more than 4.5 times higher. Death rates are also slightly higher than among white people. So closer to home, we are seeing that same disproportionate effect. According to the census, the 15.6% of Milwaukee County's population is Hispanic or Latino. However, the rate of positive COVID-19 cases sits at nearly 30%. Now, this is compared to a population that is 64.2% white. The rate of positive cases, COVID cases that is, among the white population is at 33.7%. So now let's talk about this issue as it relates to Milwaukee County.
Dr. Jorge Romeo is from 16th Street Community Center joining us. And I'd like for you, doctor, to give perspective on why you're seeing so large numbers of COVID-19, especially on the South Side within the Latino community.
Sure. Hi. Good afternoon. Thank you for the invitation. So I work at 16th Street Community Health Centers, and we are actually one of the busiest testing sites in the entire county. We have done at least close to 13,000 tests so far since the beginning of the pandemic. And we have seen positivity rates that have been steadily between 20 and 30%, which compared to the state average has actually been way, way above. So we have been experiencing what the rest of the state is now finally seeing. And that just highlights the disparities that we have seen in our population.
Can you speak on the why? Can you speak on the why you're seeing those numbers? What is it that has these numbers rising in this community specifically?
Absolutely. We have a lot of essential workers, people that cannot work from home. They need to go to their jobs in the construction industries, service industries, restaurant industries, so they cannot stay at home. We have a lot of overcrowding and multi-generational homes in which we have a lot of people that live with their grandparents, their aunts, their uncles in a very small space. So the risk of somebody giving COVID to the rest of their family once they contract it is extremely high. And the opportunities for isolation after you contract COVID in a small space like that is very minimum.
Dr. Romeo, can you tell us how you are connecting to those who need the help and how those who need the help can find you?
Absolutely. I will point everybody to our website, which is sschc.org. And that is the main clinic website. We have a lot of resources. We have also been doing Facebook Live events in which myself and some guests will talk about different specific topics about COVID. And most importantly, just take questions from the community and try to connect with them and see what types of questions and misconceptions they may have about what COVID is and how to best prevent it.
And these are all offered bilingual?
Absolutely. The Facebook Live sessions that we have are exclusively in Spanish, and the website is both in English and Spanish.
Dr. Jorge Romeo, thank you so much for joining us today and giving us more perspective. As this pandemic continues, of course, you can find the latest coronavirus news and numbers from Southeast Wisconsin on our website, including resources for where to get tested at tmj4.com/coronavirus.